Not only has Malawi recorded the worst death toll from Cyclone Freddy, there are concerns now about a cholera outbreak and warnings that children are likely to be the worst affected. There could be other waterborne diseases spreading even in Mozambique. Let's talk more about the situation now with Unicef's Guy Taylor. Guy, a very good evening to you. Grateful for your time. How much has the situation improved for the victims of the storm in the last week?
Well, I think the situation is still extremely serious, and as information has continued to come in over the recent days, we have actually seen the toll of the cyclone increase. Latest numbers for Zambezia province alone put the death toll for Mozambique at 143 people. So that's obviously a significant increase on the figures previously shared. The numbers are coming in. And the impact is larger, I think, than had initially been reported. That's largely because large areas of the areas impacted are very rural, cut off from access, and telecommunications has also been a challenge in the area. From the Unicef perspective, we're very, very worried about the surge which we've seen in cholera cases in recent days. So the number of cholera cases in Mozambique is now over 11,000. That represents a quadrupling of the number of cases since the start of February. We've seen around 2,600 cases in just the last week alone. This is particularly concerning for us because of the risks that cholera poses to children, particularly children who are malnourished, who are then particularly vulnerable to death and serious disease from diseases like cholera. So it's still a very serious situation here, I think.
And are many of the children in the affected areas high risks, i.e., are they malnourished?
Yes. So in Mozambique, we have around 250,000 children who are experiencing severe acute malnutrition. We know that when a child is severely malnourished, their risk of death from any cause is around 12 times higher. So, of course, when they get cholera, that presents a huge risk. So a bout of cholera, really, for a child in Mozambique can be tantamount to a death sentence. It's extremely worrying. In the areas affected by Cyclone Freddy and by the flooding which followed it, there is very limited access to clean drinking water at the moment. Authorities are working hard to try to restore that, but it's a major challenge. And so that means that many children, many families, who I spoke to when I was there, are just unable to find water to drink for their children. They're relying on rainwater or standing water as their sole source of drinking water, which is a major problem.
Right, there have been those desperately sad scenes of people who are drinking water that came from the cyclone itself. It is filthy. There was also an issue with access to the areas worst affected by the storm. How much is that complicating efforts to reduce the risk of a massive cholera outbreak?
Well, it's complicating them for sure. I mean, the other risk is that when children and families are not able to access health services, prevention and treatment services, when they do get cholera, the chance of dying from it goes up substantially. And as we know, many of the areas which are affected by the cyclone are still struggling to restore access with roads blocked by flooding and many villages and people blocked off by flooding from support. So UNICEF's working with our UN partners, with government, with local NGOs to bring in large quantities of supplies. We've brought in 8 truckloads of supplies worth over $300,000 in the last couple of days. Things like water treatment, chemicals, water storage containers, hand washing stations, tents that can be used as healthcare centres and schools. But there's really a huge job to be done, and more support is urgently needed.
We're speaking about prevention, but I wonder in cases where there is already a cholera outbreak, where people are staying, for example, in some of the large shelters. They're not all run by, shall we say, prominent organizations such as yourself. Local aid groups are also working. But where there is an outbreak, for example, in a camp, so to speak, are you able, as the professionals, to pick that up quickly?
Well, we're working very hard with a lot of NGOs on the ground and with government to make sure that children do have access to these treatment services when they do get sick. But as you say, it's very difficult. The scale of the need is huge, and Mozambique is dealing with many humanitarian crises at the same time. We have 2 million people in need of humanitarian support in the north. The response to this cholera outbreak, we have response to polio. This is in a country which is already facing many challenges, high rates of poverty. So the humanitarian community is very thinly stretched here at the moment. Unicef's calling for $50 million now in additional support to enable us to respond effectively to the cholera outbreak and to the impact of Cyclone Freddy. But at the moment, we are very thinly stretched, and it is a challenge.
And lastly, Guy, for those who do make it to a hospital, say in Malawi and Mozambique, there was a concern about the lack of treatment available. To what extent are the hospitals, the health facilities, equipped to deal with an even larger outbreak, for example, compared to what we've already seen in Mozambique, especially the surge since September last year?
They're very overstretched and very overcapacity. Many hospitals and health centres in Mozambique and indeed in Malawi don't even have access themselves to clean running water, which obviously makes treatment a major problem and can even give rise to further transmission. So again, UNICEF is working to support these health centres, and many of those health centres, of course, were damaged by the cyclone, having their roofs torn off or even being knocked down in some cases. So we're working to try to support them, but again, it's a huge burden of cases to deal with a very overstretched health system. So it's a big challenge at the moment.
Guy Taylor, thank you very much for speaking to us. Guy is with UNICEF.